I request Monica to speak on the topic multidimensional poverty and disability, what the data can tell us. Monica is a physiotherapist with a master's in economics from Universidad del Rosario in Bogotá. She is currently working as an assistant professor at Universidad de los Andes and deputy director of the Sustainable Development Research Center. She is also a research associate working on topics related to disability, poverty, and supporting countries in designing their national multidimensional poverty indices. Her main research topics are disability, poverty, sustainable development, and health economics. Welcome, Monica.
I'm going to present about multidimensional poverty and disability and what the evidence can tell us about this relationship and the relationship between multidimensional poverty and disability and how we have analyzed it until now. Next slide. My presentation will be divided in 6 parts. The first one, we're going to talk about multidimensional poverty. Then we're going to discuss a little bit how multidimensional poverty and disability are related. I'm going to show some evidence of previous studies and the evidence that we have with the global MPI or the global multidimensional poverty index, and also some other evidence and some points that we can take into consideration when we are discussing and thinking about analyzing multidimensional poverty and disability. Next one. So when we think about multidimensional poverty and when we think about the description of poverty, we know that poverty is a complex phenomenon that is not only related with income or consumption, but is something that is related with different aspects. So the World Bank in the 19th, at the end of the 19th, conduct one of the most important qualitative studies about poverty, the Voices of the Poor, and they interview more than 200 people around the world, and they ask them what is poverty for them. And these are some of the quotes that they have produced and they have taken from those from this study. I want to highlight some of these because it really highlights that poverty is more than just income, but poverty is something that is more complex. For example, the second quote says, when food becomes scarce, we only eat once a day to allow our children and husband to eat. This is a woman from the Philippines. This means that it's not related about not having income, it's related about having food as a scarce resource and that they have to prioritize who eats in the house and who doesn't. If we see the last quote from a woman from Brazil, she says, I'm afraid that they might kill my son for something as irrelevant as a snack. This means that poverty is related to that sensation of insecurity, that sensation to feel that something that is really irrelevant as a snack can become the reason of dying of one of their sons. So if you read and you have the opportunity to read these books, what it really highlights is that poverty is a multidimensional phenomenon and that poverty or people who live in poverty are facing multiple deprivations. Next slide, please. And when we think about multidimensional poverty, we really need to consider about that. We really need to consider how these joint deprivations are merged and how people with disability, people who are living in poverty usually face multiple deprivations at the same time. This means that you are not only living in poverty because you don't have access to education, but you live in poverty because you don't have access to education and also don't have access to health or don't have a proper employment or are discriminated or you are not having access to different basic opportunities or capabilities. In addition, it will be important that to keep in mind that multidimensional poverty, it does not only reduce when you reduce poverty or you say the person is not inside poverty anymore, but when you reduce the different deprivations, you will notice that people who are living in poverty will reduce their severity or the intensity of their poverty. So if I'm a person who is living in poverty and I'm not deprived anymore in access to health, my poverty levels are lower than the previous one. So it's really important to recognize that multidimensional poverty, it's not only this complex figure or this complex situation, but it's also that you really need to focus on different deprivations and how these deprivations interact. One thing that is really important is that the SDG #1 and poverty in all its forms everywhere mentions in target 1.2.2 that we need to reduce poverty for all. That the idea is that by 2030, reduce at least by half the proportion of men, women, and children of all ages living in poverty in all these dimensions, according to national definitions. This target becomes really important because of different aspects. First, is the first time that international development goals mention the importance of multidimensional poverty. Second, it says that every person, like men, women, and children of all ages, needs to leave poverty, or at least half. And this includes persons with disabilities, even though in this indicator is not explicitly mentioned, it is implied in there. So you cannot reduce by half the proportion of men, women, and children with living in poverty if you only focus on those who are not disabled. You need to really include people with disabilities in order to leave no one behind. And the final thing that is really important in here is the fact that they call for national definitions. And in that case, we are advocating for disaggregated multidimensional poverty measures. We need to also talk to the governments who are creating these MPIs to disaggregate by disability status and use that information in order to inform policy for persons with disability. Next. So we're going to revise a little bit the evidence that we have on how multidimensional poverty and disability are related. So we know that because multidimensional poverty measures are covering all these different deprivations in access to opportunities and services, and we also know that persons with disability are more likely to be outside of school, or are more likely to be unemployed or outside the labor force, and are more likely to be discriminated. We have some stigma. So multidimensional poverty measures can capture better the realities of persons with disability living in poverty. Also, there are facts, or there are things that we need to consider when we are thinking about multidimensional poverty. We need to consider that every measure has a different purpose, and because most of the measures include different indicators and different dimensions, you can have that there are measures that are created that don't capture as well what is multidimensional poverty for persons with disability. One important fact is that we need to consider what are measures captured or computed at the individual level and measures captured at the household level. And we are going to talk a little bit more when we talk about the global MPI and other indices that have been computed for persons with disability. Also, depending on how you design the measure, you can see that the results are not what expected or are counterintuitive. This means that maybe in some countries you will see that there are persons with disability or households with persons with disability are not the poorest, but you really need to understand what is behind the measure in order to really take advantage of the information that is provided. Next one. So the evidence in multidimensional poverty, or the first study that I have in my mind that has analyzed an index of or an MPI, and disaggregated by disability study, was the MITRA in 2013, that they analyzed 16 countries that have the World Health Organization survey, or have collected the World Health Organization survey and have questions on disability. And that disaggregated the measure between different disability status and severities, and also compared for persons with and without disability. What they found is that in the case of multidimensional poverty, persons with disabilities are more in risk or have high levels of multidimensional poverty. And usually in most of the countries, they found that persons with more severe disability status have higher levels of multidimensional poverty. There are different studies of Trani et al. And different co-authors that have analyzed multidimensional poverty for children or multidimensional poverty for different groups in Afghanistan, and they have found that persons with disability or children with disability are more likely to be multidimensionally poor and have higher levels of deprivation. There is another study in Angola that have disaggregated also multidimensional poverty child measure and found that children with disability are more likely to be multidimensionally poor and deprived in most of the indicators. Next one. When we see the evidence related with the global MPI, and the global MPI is an index that next one, please. When we see the evidence related with the global MPI, and the global MPI is an index that is computed using 10 indicators and 3 dimensions, and it's an international measure that is comparable between countries. We see that when we disaggregate the data that in 10 countries that include questions on disability, especially usually in the Washington group, we found that persons with disability in most of the countries are more likely to live in poverty or in multidimensional poverty than persons without disabilities. In here, it's important to highlight that we are analyzing persons living in households with members with disability, and we compute the measure
Monica,
at the
you have
household
2
level.
minutes more. You have 2
Okay.
minutes. I'm so sorry.
Okay. No worry. And we compute the measure at the household level. So in this case, we find that in the case of Colombia and Mali, persons with disability are less likely to be multidimensionally poor, or in other words, the proportion of persons who are multidimensionally poor that live with a disability is lower in these countries. And this is given because most of those countries are, or these two countries have cover most of the indicators living in the dimensions of living standards. Next one. But when you go to indicators or you go to the evidence of MPIs computed at the individual level, this means that we are computed the deprivations for persons with and without disabilities and compare between them. We found that in this study that includes data from Cameroon, from one region in Cameroon and India and one national representative survey in Guatemala, we found that the incidence of multidimensional poverty for persons with disability was higher than for persons without disabilities. And this was significantly in the different countries and in all the indicators. Next one. If we see and analyze, and I'm going just to stop a little bit in this next slide, is that when we analyze the different indicators, and in here we were really careful in including indicators related with the environment and attitudinal barriers, we see that the darker line in these graphs is showing us the deprivations of persons with disabilities. In here, what we are seeing is that the proportion of persons with disabilities that are deprived in India, Cameroon, and Guatemala in most of the indicators is much higher than the proportion of persons without disabilities that are deprived in those indicators. It is important in the graph in the left side that it represents the deprivations in Guatemala and for persons with and without disabilities, that persons with disabilities are more deprived in aspects related with access to social benefits or school attainment or access to employment. Instead, the indicator related or at the household level are the lowest. Next one. Similar findings we have found in one study that was conducted in Nepal and in Vietnam, where an MPI computed at the individual level was created for persons with and without disabilities. And we found, can you move to the next one, please? And we found that persons with disabilities are much higher and have higher deprivation levels than persons without disabilities. Again, in this measure, we made sure that when we were including indicators for persons with disabilities, those indicators were capturing access, for example, not only to water, but what is the accessibility to have access to that water? Is is an accessible toilet, for example, in sanitation? And this final study, before I conclude, is the only group-specific multidimensional poverty measure that has been created. This uses data for a specific survey that was collected for persons with disability and include indicators that are disability-specific and indicators that are general. In this study, they analyzed the severity or the levels of poverty according to the severity of the disability and different categories. In here, they found that more severe disabilities, those groups are more likely to be poor, and also people with communication difficulties are also more likely to be poor. Next one. So persons like multidimensional poverty is a new measure. It's a new measure because we have only computed this type of measures in the last 10 years. The number of studies has been increased, or studies analyzing the levels of multidimensional poverty for persons with disability has increased in the last 5 years. It's really important to properly analyze the results of this and taking into consideration that if you compute a measure at the individual level, you can see big gaps in between persons with and without disabilities. And what the evidence is telling us is that persons with disabilities are more likely to be poor in all settings if you use an individual measure. And also, persons with more severe disabilities are more likely to be poorer. So we are leaving behind some people in there, and persons with disability are one of those groups. Thank you very much, and sorry for taking 1 or 2 minutes more at the time. Thank you.
Thank you, Monica. Now